Today, we are going to talk about Graves' disease as part of the Medical Brief series by Pace Your MRCP, led by Dr. Tanzil Bukhari. Graves' disease presents with a variety of symptoms that affect multiple systems in the body. The most common symptoms include heat intolerance and excessive sweating, which can be quite distressing. We also see increased bowel frequency and menstrual irregularities, reflecting how the disease impacts different bodily functions. Moving on to metabolic and muscular signs, weight loss despite a good appetite is a key indicator. Patients often experience fatigue and proximal muscle weakness, making everyday tasks challenging. In terms of cardiovascular and neurological symptoms, palpitations are frequent, accompanied by a fine tremor. Anxiety and irritability are also commonly reported, showing how Graves' disease can influence both the heart and the nervous system. Now, let's delve into the signs and examination of Graves' disease, starting with the Graves-specific features. These include exophthalmos, which is the bulging of the eyes, lid retraction, and lid lag, and ophthalmoplegia, where the eye muscles are affected. Other distinctive signs are pretibial myxoedema, a skin condition on the shins, and thyroid acropachy, involving changes to the fingers and toes. When assessing a patient, it's important to carefully evaluate the thyroid itself, noting its size, symmetry, any enlargement, and the presence of a bruit, which is a sound indicating increased blood flow. Additionally, we look for signs like a rapid pulse, hand tremors, muscle strength proximally, and any abnormalities around the shins. Moving on to the general hyperthyroid signs, patients often present with a diffuse goitre, tachycardia, or sometimes atrial fibrillation, and a fine tremor. Their skin tends to be warm and moist, with hyperreflexia, meaning heightened reflexes, and proximal myopathy, which is muscle weakness closer to the body's center. Starting with diagnosis, the initial blood tests typically include measuring thyroid-stimulating hormone, free thyroxine, and free triiodothyronine levels. These give us a clear picture of thyroid function. For more specific investigations, we look for thyroid receptor antibodies, which are the most specific markers for Graves' disease. We also check for thyroid peroxidase antibodies. If needed, a radioactive iodine uptake scan can be performed to confirm the diagnosis and assess thyroid activity. For definitive treatment, we often consider radioactive iodine therapy or thyroidectomy, especially for selected patients. Ophthalmopathy associated with Graves' disease requires specialist care, which is crucial for effective management. When it comes to antithyroid medication, carbimazole is usually the first-line treatment, while propylthiouracil is preferred during pregnancy and in cases of thyroid storm. In terms of symptom control, propranolol plays an important role by reducing tremor, palpitations, and tachycardia, helping patients manage their symptoms more comfortably. Graves' disease is the most common cause of hyperthyroidism and is characterized by a classic triad, a diffuse goitre, hyperthyroidism itself, and distinctive eye signs. What makes Graves' unique is that it's the only common cause of hyperthyroidism linked with ophthalmopathy, which can severely affect vision. It's important to be aware of the serious complications that can arise, including atrial fibrillation, heart failure, osteoporosis, thyroid storm, and vision-threatening ophthalmopathy. Be sure to follow Medical Briefs for more high-yield videos on MRCP UK, MRCPI, PACES, and internal medicine. This will help you stay updated and well prepared for your exams and clinical practice. Consistent learning from trusted sources is key to your success. Good luck.